Hi, I'm Stuart Wright, the chair of the QHC Board of Directors. It's my pleasure to take you behind the scenes at QHC to celebrate the work of our teams, our partners, and our communities in responding to the COVID-19 pandemic. The Wall of Hearts at each of our hospitals has greeted our staff every day since the pandemic precautions started in our area. Messages on the Wall of Hearts express the hope, concern, and gratitude of community to the staff and physicians that continued to come to work while most of us stayed home. Our partners and our communities have certainly shown their passion and appreciation for our teams in what has been an uncertain and fearful time for all of us.
Being a registered nurse 25 years ago, if you told me when I graduated that we would ever go through a pandemic, and here we are living it. These are difficult times that we are all facing, and the team, and not just the staff, the managers and the CEO, they've all kind of come together and addressed our needs and supported us, and not once did we ever feel like we were alone.
It makes me very proud actually to see what staff have done in light of COVID and all of the changes that we've had to make in the hospital in order to manage patients and make sure that staff have the equipment and the PPE that they need.
And I think more so than ever, that team has come together to make sure that we provide the best possible care in this pandemic environment.
I think mostly it's just been, we've been scared of the unknown. We've been really good as a team to plan for the unknown.
What has really impressed me is how no matter how much our staff or our physicians might be worried about themselves and about their family and about what it could be for their own impact on their own health, they all knew that their job is to be here for our patients.
At the beginning of this, we had no idea how hard we would be hit. Our teams needed to prepare for the worst while hoping for the best.
From a physician standpoint, there's even just going back to the basics of learning about an entirely new disease, a disease that we didn't really know anything about, and then trying to learn how to treat those patients. And so several hours just went into kind of learning about coronavirus itself. And then from a corporate standpoint, it's particularly with the Emerge, because it would be the primary point of entry for everybody coming into the hospital as a suspect case. We had to think about how to separate our emerges into respiratory and non-respiratory zones, which we've since now termed hot and cold zones. We had to think about personal protective equipment requirements and for what instances we would need those. We had to learn about an entity that I haven't really had to put a lot of thought into, aerosol generating medical procedures, and how to best protect our staff. We had to think about how we're going to transfer patients from one hospital to another, because we're not just one hospital. And how do we protect our patient while protecting our staff? And I would say the cognitive load that's associated with COVID is immense.
The learning curve was steep and changes were constant. We suddenly had to make extremely difficult decisions, limiting the number of people coming into hospital, including restricting visitors and pausing our tremendous auxiliary volunteer program. We had to screen everyone coming into our hospitals, had to make changes to spaces across our hospitals, and many QHC staff members took on completely different roles to support COVID-19 preparedness. One example is the COVID-19 warehouse team, focused on ensuring our staff and physicians had what they needed to be safe in the face of global PPE supply shortages.
We were a little bit surprised by how many different organizations stepped up and were willing to support us, and individuals as well, people going through their own personal supplies and saying, you know what, like, I know that you guys need this more than I do, please take it, like, you take whatever I have to help support the frontline workers. And it's been really quite touching, or reflects rather, like QHCs, we all help provide care. It's not just the hospital, it's the whole community working together to support the healthcare system and each other and keep everybody safe.
For myself, I usually work in Emerge as a discharge planner, so I was very humbled to know that even though I wasn't on the front line, I was still doing my best to protect those frontline workers.
It's brought us all closer together. we've met a lot of employees that we would never have met before, and just we've gotten a broader knowledge of what their roles are, and everyone has stepped up and out of their comfort zones to make sure everyone is safe and healthy. It's really shown us how we can come together as a community and as a corporation.
The pandemic forced us to embrace technology in a way we haven't before. Over the past few months, we've accommodated thousands of virtual visits for patients and their loved ones. Our meetings have moved to video conferencing. Our education and professional practice teams have designed online orientation materials, including instructional videos for onboarding new staff, and our clinicians have used video for patient appointments as much as possible. Our staff and physicians have done a remarkable job adapting to our new realities.
Under stress, with a lot of uncertainty, people really came together and not just collaborated to coordinate a response to this pandemic and change our operations, but really to support each other, which has been heartening and really underscores what we're all about.
The pandemic has highlighted the power of collaboration. Our teams have worked in tandem with the local paramedic services, family health teams, public health, municipal partners, local business partners, and even the Department of National Defense. QHC has been involved in the development and operation of local assessment centers across the region, including Belleville, Trenton, Bancroft, and Prince Edward County.
The assessment center here in Picton was an incredible collaboration. It has been absolutely incredible to see how we were all able to work together so quickly and so effectively.
We redeployed some nurses from the OR and put them in an assessment center, and they were amazing. They were nervous at first, and we learned along the way together, and they adapted really well. We have MDRD staff, we have screeners who are working outside in parking lots, and all sorts of changes and new things.
Our community did what they could to support our teams from a distance, with our foundation staff playing an integral supporting role along the way with a team of local volunteers.
People using 3D printers, all of the people that were recruited to sew gowns, people that were sending us mask templates and hood templates for our intubation kits, to the EMS and the paramedics that drive past and have their sirens going, to everybody that says thank you for what you do when we see them in the emerge. Our community deserves a ton of gratitude.
Whether it's our staff, our physicians, our community members, I just want to thank everybody. We've been together as a team through this, working through this. We know that more may be coming our way, but we're going to be really prepared because we showed how when we all work together, how we can accomplish really, really great things. So thank you to everybody in this first few months. And we're in this for the long haul, and I've always been so proud of all of our staff. It is all about exceptional care inspired by you, and I know that they're there when we need them again.
On behalf of all the QHC Board of Directors, it's with great pleasure and immense respect that I thank all members of the QHC team for your agility, for your resourcefulness, your innovation, and your devotion to the calling that is healthcare. You are all shining stars. You are all heroes. You are Team QHC.